Good afternoon. Thank you for joining us for this special superintendent's webinar. Obviously, we are covering the COVID-19 issue. We want to be here this afternoon to address questions from our school district families across the state, administrators, and to answer your questions as we're dealing with this issue. I'm here in the state boardroom, and all morning we've convened the KDE leadership team and members of the Kentucky Department of Education in an Operations Center format. We're doing this. We want to be able to answer your questions instantaneously. We've had several calls from superintendents today and answered a lot of questions. We're also populating a question and answer document that will be posted online. There are just a lot of operational questions that are coming up about school closure, food service, all testing, all the issues that you're dealing with on a daily basis. I understand that you have a lot to deal with on a Friday before a multi-week closure. Understand if you need to come in and out of the webinar will be archived. We're also taking questions, of course, as we normally do. That the access code and the link is the Go Soapbox link. It's on the screen right now. Please email us your questions. We will also be, to the extent we run out of questions you're submitting on that format. You've been sending us questions, texting us questions over the last 48 hours. We'll be addressing those. I'm committed to stay here as long as necessary to answer questions from superintendents live, and we will continue working all weekend to update the Q&A document. We will release a portion of the Q&A document this afternoon so you can get some answers out there, get some questions answered. In addition to the superintendents on the webinar, we have our K group partners, our support partners. We also have the directors of the 8 education cooperatives have been invited to this webinar, and then there are others I'm sure that are joining us, and so this is a public format. It's not a closed meeting. It's as far as it's not a public meeting, but many folks have access to the webinar, and we want to make sure we're getting the information out there. Before we get started, I want to thank everyone in the education community for what you have done so far. We're really working together as a state under the leadership of Governor Beshear and the way he has handled this matter. I also want to give a shout out and thanks to the public health community. I had not interacted with those folks until the last few days, and I just can't tell you the level of expertise, professionalism, and you see that exhibited every day by Dr. Stack and the Commissioner of the Cabinet for Health and Family Services. So thank you for that. And then I know you all are having day-to-day contacts with your local health department officials, and I'm hearing stories of how those relationships are very strong and a lot of cooperation going on. So I want to thank you for that. We do have some special guests with us here, some experts in their own right to assist us in addition to the KDE team, and I think there was you just saw a shot there on the webinar. We have the entire KDE leadership team assembled here, and then we also have Dr. Connie White with the Kentucky Department of Public Health. She's going to say a few words in a few minutes. Dr. Damian Sweeney, you all know him very well. He's our lead program coordinator for comprehensive school counseling for KDE. He's going to be here to answer questions. And then we're very thankful for Harrison County Superintendent Dr. Harry Burchett to be here with us today. As you know, he was on the front lines and the first to deal with the coronavirus, the COVID-19 issue. And he has a lot of expertise that he has developed over the last 2 weeks or week. And he indicates that this issue was not covered in the new superintendent training. However, he has responded very well to it, and so thank you for that. I'm just going to kick it off by talking about just the main issue that we're hearing, and that is a little bit of confusion over what does it mean to be the social distancing issue, and what does it mean should we be telecommuting. So I want to be very clear, this is a public health issue. So this is not a we're not doing this for just logistical reasons. The governor has asked the school district community to be a primary player in assisting our public health community in social distancing. So, and Dr. White will explain to us in a few minutes what it means to flatten the curve. And so what we are doing is practicing social distancing so that the virus is either slowed down or not spread, so that we don't have a spike in cases. And school districts are the primary partner in this just because of our numbers and where we are in the communities and the number of people we gather together in a building every day. And so the governor has talked about in his press conferences, the last two press conferences, a lot about the ability of local school districts enabling workers to telecommute, and he's even mentioned that for public and private employers. What he means by that the best case scenario is that, for example, if you have if you're going to use NTI, non-traditional instruction, that you permit certified employees to telecommute. That is permitted under the NTI statute, or the NTI process, meaning that an NTI day is a contract day for your certified employees. And so you are free to have them issue deliverables to them that they can work from home if that is something that you think is necessary. So I want to make sure that we address that issue. I also want to say that I think before we get to that, let's just start with our guests. I think, Dr. Burchett, I want you, before I say any more, I think you should just kick us off and tell us how you've handled this issue.
Well, thank you, Commissioner Brown. First, let me praise you and your staff, because something that came to us so fast last weekend, by Saturday afternoon, you were reaching out to me and offering your assistance and the assistance of your entire team. And of course, made it clear to me that you were having a meeting with your staff on Sunday to discuss how you can help both Harrison County and other districts in the future. So I won't get into the weeds and the minutia of all the back end stuff, but we put out our, like many districts, put out our first coronavirus communication on Friday afternoon, sent it home with students by 6 o'clock or 6:30 or between 6 and 7 on Friday evening. We learned that Harrison County was ground zero for the first patient of COVID-19 in Kentucky. Our county judge, Alex Barnett, and Mayor James Smith, Dr. Crystal Miller of WEDCO, and Sheila Kearns of HMH immediately went into action to address that issue. They called a community planning meeting for leadership Saturday morning at 9 a.m. We met there. We learned the details of our situation in that community, which included I would say a larger than normal amount of possible exposure in the medical community, as well as an unknown amount of community level exposure. The first patient was community acquired. They could not decide or determine where the source came from. So given that information, we decided as a school district to cancel school for this week and utilize our NTI program to help give the public health officials a chance to get ahead of this thing. And I just want to praise them, because they certainly, Dr. Stack and his team and Dr. Miller, they utilized that time with their epidemiologists in Harrison County on the ground, tracing those possible exposures and really get ahead of that. We now today have 6 confirmations in Harrison County, and they know the trace infectious path of each and every one of those cases after that first initial case. So that's what we were faced with. We gathered our team together and decided we had one imperative. We were going to provide for the safety and well-being of our students, staff, and community. Number 2 was that we would provide continuity of services for both instructional and nutritional services. And we put those plans into place effective over the weekend and notified our community and started doing both NTI and meals on Monday. Our meal count grew. It's a product of both a drive-up and a delivery system, and it has grown from about 200 meals on day 1 to close to 500 yesterday. So it is much needed and very effective, and we decided as a community that we would be providing those regardless of whether or not we received a waiver from the federal government on that reimbursement or not.
Thank you, Dr. Burchett. That's a great example of, and of course, Dr. Burchett's using the NTI program. So we're getting a lot of questions about NTI has been talked about a lot, but not all districts are approved for NTI. About 24 districts are going to come on, or have at least applying to come online due to the waiver process. So we have 83 districts that were NTI, approximately 20 more that are applying that could be approved as early as this afternoon or next week to come on as NTI, to provide NTI services during the closure. So there are two categories of closure over the next few weeks. You're either closing and it's an NTI day, which means it's a contract day and it counts as a day, or it's you can have a traditional closure. You can close schools the old-fashioned way before NTI was ever something, and districts that aren't approved for NTI, of course, that will be a traditional closure day. That means that day is added on at the end of the year. So those are the two categories that the days fall into. If you're doing an NTI day, then we get into the question of the governor's encouraging telecommuting or teleworking as much as possible. Many of you operate your NTI days by having teachers report into your buildings. And there's confusion that is existing now because you're getting a recommendation from us and from the governor in public health to encourage telecommuting. And what I was saying before Dr. Burchett spoke is, if you've never had teachers telecommute during an NTI day, it is permissible for you to do so. Now, if you're not comfortable with doing that, and if you don't think you have time to do that right now before Monday or Tuesday to have those deliverables, that the expectations you would have for them if they telecommuted, you can still have teachers report to your buildings. However, I want to caution you, if you do that, you need to practice social distancing. Do not bring teachers into the auditorium 100 at a time or 20 at a time. Because if you're on an NTI day, the teachers are there to be providing support to students and to facilitate that NTI day. So Mr. Brown should be going to Mr. Brown's classroom. Mr. Allen should be going down to Mr. Allen's office or classroom, and you need to be practicing social distancing in that environment. So we will get into some questions about that, but that is the major question we're receiving. We've had actually 69 districts have applied for the waiver. I've just been informed. So it was 20 as of yesterday, I think, or so, and now we've had 69 to apply to be NTI districts using the abbreviated application, and then we're asking the State Board of Education on March the 18th to grant a waiver to bring you in to the NTI. So thank you for that. The next best thing to having kids in school is having kids, if kids can't be in school, if they're out of school, to be getting instruction virtually or otherwise. So thank you all for responding in that way. However, you may also have a mix of days. You don't have to use all NTI. If you want to have an NTI for 3 days and then you want to have traditional closures for those days. We're also getting a lot of questions about, okay, what if I'm not NTI but I close the entire over the entirety of the next few weeks? Those days are added onto your calendar. We know that when there are things that have happened in Kentucky over the years, and it's generally always a lot of adverse weather during the winter or a flu outbreak, the General Assembly has traditionally had some type of relief in a budget bill or other bill to address that issue, particularly if districts are going way into June for those makeup days. I can't say what the General Assembly will do. I can tell you we are talking to the General Assembly, and there's a lot of discussion over there. There's some floor amendments that have been filed to address that issue, and I feel very confident that something of that nature, I don't know what it will look like, will be there to address the issue if we have districts that aren't NTI, or if they are NTI and they still have to have days where they're going on into the summer, that we will address that or try to address that in one way or the other. The other issue that's coming up with NTI is, in statute, NTI is only permitted to be 10 days. We can't waive that with the state board because that's a statutory requirement, not a regulatory requirement. Again, we're having discussions with the General Assembly, and I believe there is a lot of support in the General Assembly to increase the number of NTI days permitted from 10 to around 20. And if we have to have more than that, we can address that as well. So I feel very confident that we will be able to increase the number of NTI days available to you from the 10 to at least 20. If for some reason we were not able to get relief in the General Assembly, then we will obviously be talking to the governor. I know the governor will be very receptive to doing executive orders as may be necessary if we have to do that. I also wanted to, something else that came up today, the school nurses, we've heard that they have been very responsive. So our school nurses in the district are planning, many of them are planning on continuing to come in and offer nursing services as may be appropriate in working with the local health departments. I encourage you to talk to and email our school nurse consultant, Angie McDonald. She is here today. She's practicing social distancing in the back of the room. If you want to get some advice on how some other districts are utilizing their school nurse or will be utilizing their school nurses during this time. As you know, the governor has strongly encouraged that all schools close beginning on Monday. I fully support that, the governor in that recommendation. That recommendation came after consultation with public health and their expertise. And as I said earlier, it is necessary during this time to ensure that we try to flatten that curve we'll hear from Dr. White explain what that means in a few minutes. However, there are at least 4 districts that are not going to be able to close Monday, but that will close starting Tuesday. And I believe those are Crittenden, Bell, Henry, and Somerset Independent. And the reason for that is I believe those districts were closed today for one reason or another. Some of them were for in-service days, in-service day, and the students in those districts were not able to be there to pick up Chromebooks, assignments, etc. They need that day on Monday to come in, get the NTI assignments or other assignments, and those districts, it's my understanding, will be closing on Tuesday. So superintendents, I need to be able to give the governor's office and the Office of Public Health today a number of districts and confirmation that we are in fact closing no later than Tuesday. So I'm going to ask you as superintendent, I don't need you to email me if you are closing. I need you to email me if you are not planning on closing by Tuesday. So if you intend to stay open, then I need you to email me, and we will have an offline conversation about that. And if I need, if you need me to talk with your board chair, et cetera, we will have that conversation. So please email me if for some reason your district is not planning on closing. And I've just been informed we have 96 closures that we have confirmed so far that will the majority of those obviously will be closed starting Monday, and then there are 4 of those that will be closed starting Tuesday in response to the governor's request. I also want to point out that we asked the Kentucky School Boards Association this morning if they would be willing to redistribute information that they have to local board attorneys as well as superintendents and board chairs regarding the ability to conduct public meetings virtually using virtual technology that is permitted by the Open Meetings Act under certain circumstances, and there are a lot of rules associated with that. We've been receiving feedback from districts that they would like that ability during this time. Particularly, there may be members that are in a higher board members that may be in a higher risk category, and they might feel more comfortable participating in the board meeting electronically. There are ways you can do that. You will need to consult with your board attorney because there are certain rules. It is not as simple as just turning on Skype. So, however, we want to make sure you had that information because we know those conversations are taking place. So please be looking for that email that went out this afternoon from the Kentucky School Boards Association about how to conduct a public meeting virtually. And we want to again thank the Kentucky School Boards Association for that information. And then before we get to the remainder of our guest, and then we will get into the questions, I wanted to reiterate, and I also want to thank Commissioner Tackett for his leadership yesterday, and as I mentioned in the press conference with the governor, in indefinitely postponing the remainder of the girls' Sweet 16 and the boys' Sweet 16. As I said yesterday, there were a lot of disappointed young ladies on buses last night headed back home, and disappointed that their dream of playing in Rupp Arena may not be fulfilled, and the boys that were headed to Sweet 16 feeling likewise. So that was a difficult decision, but it was the right decision. And those, as I said yesterday, those student athletes really took one for the team, and they are making that sacrifice for the greater good of the Commonwealth. I want to thank, again, Commissioner Tackett for his leadership. And then today, there's I think the Board of Control met today and discussed. It is very important that, and this is, and I asked, and Commissioner Tackett was already thinking in this vein, but we want to make sure when school is closed that we don't drive by our campuses and see teams practicing, and because that completely defeats the purpose of the social distancing. So KHSEA will be releasing soon, if they haven't already, guidance and directives on the restriction of practicing and playing during the period of school closure. That is very important from a public health perspective. So I want to also thank the Board of Control and Commissioner Tackett for their leadership in that area as well. Anything else before we kick it over to Dr. White?
No, I think Dr. White can go on.
Okay, and again, we want to remind you to get your questions ready if you haven't already. The Go Soapbox is coming back up on the screen.
I have several
And
questions
then the KDE access code that also there is listed. So Dr. White would turn it over to you, and please give us an update from Department of Public Health.
Well, hello. I'm Dr. Connie White. I'm the Deputy Commissioner for Clinical Affairs for the Kentucky Department for Public Health, and have worked a lot with Robin Kinney and our school nurse program at Angie. And then I'm also a member of the WISC committee for the school board committee. So been over here a little bit and know how to get around the building some. So I appreciate you inviting us. The steps that have been taken are quite impactful, as we've all talked about. Tears from ballet classes being canceled. It runs the whole gamut. I got texted by my pastor about if we don't have church, do we have confirmation class, and do we have choir practice? And I use the school system as a model. I said, if you're not going to have kids assembling for school, you don't have extracurricular activities. I think my church needs to model that, so, or to practice the model that you have given us. This sounds very harsh to a lot of people. And it is harsh. But if we look back and try to look at data to drive us as to what we need to be doing, we can look back at the Spanish flu. Now, I'm old, but I don't remember the Spanish flu. That was 1918. But if you look at two cities, and you can Google this, and it's very dramatic, and I wish I had a prop here to show you. But you look at two different cities. Philadelphia had an outbreak of Spanish flu. Within a day, they had a parade to support the troops in World War I. Big parade. 200,000 people came out for this parade. Within the end of the week, all 31 hospitals in that cities, every bed was full, and 4,500 people were dead within a week. Am I telling you that's going to happen in Kentucky? I'm telling you that's the model, that if you have a very contagious infection, this is what can happen. If you then look down across the country to St. Louis, they had an outbreak of Spanish flu. Within 2 days, they had instituted social distancing. They canceled schools, they canceled churches, they staggered people's work times, they staggered how people use public transportation. They put the social distancing out into place, and what they found was not only did they not have those huge spikes of sick people that overwhelmed the healthcare system, they had infections and it did spread out over time, but they had half as many deaths because the healthcare system was able to take care of those sick folks. So if you look at that graph, it explains to everyone why we're doing what we're doing. It's going to be hard, it's going to be harsh, but if we don't socially distance ourselves, this is a virus, just like flu is a virus. It's not the same virus, but it's just an example. And when you cough or sneeze, you spread little droplets, and I'm a physician, so I won't use fancy medical words that are not very pleasant. But you spread those droplets, and there's virus in those droplets. So everywhere it lands, that virus is on those droplets, and it dries there. And if you touch that, whether you touch a person, or you cough in your hand, or you touch a surface, and you get a mucous membrane like your mouth, nose, and eyes, and you then get that virus in your system, then you can get ill. So that's why the social distancing is critical. A cough or a sneeze spreads about 3, maybe 4 feet. So 6 feet of social distancing, that's where the 6 feet comes in. So someone doesn't spray you. Cleaning those surfaces, critical. So if there's something on that surface, you don't contaminate yourself. Because of my age, I'm very careful with stairs. My mother fell down the steps and broke her pelvis. And as you hear people say, when old people have a break like that, it changes the frailty of their health, and I saw that in my mother. So I'm very cognizant of going downstairs, but I'm also very cognizant of not touching the handrail. So I go down the stairs with my hand over the handrail, but not touching it, so I can grab it if I fall. People think I'm strange, but I'm trying to protect myself from 2 things that happen to people over the age of 60. So cleaning those surfaces, I enjoyed the comment on the KET show that Harrison County schools are the cleanest schools in the state of Kentucky right now. They've had a week that is spit polished clean there. So cleaning those surfaces that you normally come in contact, the rails, the doorknobs, the computer surfaces, the countertops, the governor's podium, and the chairs in the press room. Those are things that we have to be very careful of. And making sure we don't touch our face. I've joked that I'm going to get some of those clickers that we can give everybody in public health, so while we're sitting around talking, if you see somebody start to do something, you click at them because it is hard to forget to do that. So those are the ways we're going to get around this, is by not contaminating ourselves and by not contaminating others and coughing into our sleeve or coughing into a tissue and hand washing. It's not very glamorous. We are not up there promoting a very complicated 6-hour surgical procedure that saves a life. We're not talking about a very expensive drug with multiple side effects, but it will turn someone's life around. We're talking hand washing, cough and sneeze hygiene, social distancing, but you look at that flattening the curve pictures from the Spanish flu, and I think you'll buy into it right away. I feel like we should have T-shirts at Public Health that say, flatten the curve. We want to flatten the curve, and I think that's what every Kentuckian is wanting to do. So the 3 C's that my commissioner talks about is staying calm. That doesn't mean don't be concerned. That means be calm about your concern, because we are calm and we are organized, as you have shown us in KDE. We will make people aware and we will inform them. I always have tried to stay away from the word educate, because we deal with some very educated people. And when someone sets me down and says, I want to educate you about this, well, I get my back up a little bit. I'm kind of educated, but I might not be informed about the facts about this virus and about the facts about what this can do. So remain calm, and cleaning. Just cannot overemphasize that. Not germophobia, but I think if you understand the process of how it spreads, the cleaning just makes good sense. And then number 3 is the C is cooperate. And I think that Harrison County, as one of someone in your leadership said, I think you guys are the model of this. Your local newspaper, your radio stations, all of the folks that met together on that Saturday morning, everything that KDE has done to date with the Department for Public Health, with the governor's office. I think we're ahead of our border states. My commissioner talks to the commissioners in other border states, because if we're doing everything right in Kentucky and the other people around us aren't, that's going to make our curve less flat. So we're trying to be sure that everyone around us is working to flatten this curve. And so we are so appreciative of all the work that your superintendents, principals, teachers, cafeteria workers. I'm so impressed with the feeding program that you're doing. That's such a wonderful thing, and I know it's going to make a life difference in a lot of these children. And so I'm ready for questions whenever that time
Sure.
comes.
Thank you, Dr. White. And one thing I didn't touch on, we were talking about the two different ways you can close, the NTI closure or the traditional closure. You also have the option during those two types of closure to provide nutrition. Optimally, we would love every district that closes to be able to provide food service. That is also assisting in public health, even though you have to bring your food service workers into the building. The gain from that is ensuring that our students in their homes have sufficient nutrition, and so that is a public health issue that we need to promote. However, we also know that there will be districts, for whatever reason, that are unable to or do not want to be unable to continue their nutrition programs during closure. So that is what we prefer and what we would love to see, but we also know that that may not be feasible for every district. Dr. Burchett indicated he is right now feeding students. Even though we do not yet have an answer from the U.S. Department of Education on the waiver, we've asked for a waiver for non-congregate feeding, meaning, as I understand it currently, if you're getting the food service dollars from the U.S. Federal government, folks have to consume that. Students have to consume that on site, and we're applying for a waiver to permit that to be consumed off-site, picked up or delivered to be consumed individually off-site, and we are cautiously optimistic that waiver will be granted, and we're actually sending a letter today to our congressional delegation in Washington to assist us in hopefully having the U.S. Department of Agriculture approve that waiver. So Harrison County, for example, could then be reimbursed using federal food service funds for his effort this week in feeding those students, and he's indicated even if he does not receive that reimbursement, it will be money well spent, and he would do it all over again. So thank you for that. We know every district is different, and you have to make those determinations. Do we want to? I think, Dr. White, your time is probably more limited than most, so.
I'm here as long as you need me.
Okay, do we have any questions coming in right now related to
yeah.
public health issue that we need Dr. White's expertise?
Let me look here.
As she's looking, there are going to be many questions that I'm going to have to say we don't know the answer to. This is a brand-new virus that was just discovered in December. So a lot of the questions about the science, it's just not there. And I don't mind saying we don't know yet, and I will.
We've also adopted at the department, Dr. Stacks, the 3 C's: calm, clean, cooperate. It's on the board here, the KD Operations Center whiteboard. And superintendents and other education partners, I will remind you, even though schools will be closed, those 3 C's are operative because you are leaders in your community, and your community will be looking to you. You're already showing that you're leaders, that your leadership, that you're calm, that you're providing great leadership already, and you will continue to do that. Clean obviously means the hand washing, but also during school closure, this is a great opportunity for you to possibly utilize some days, some contract days for your classified staff to go in and do some deep cleaning. I think Dr. Burchett is doing that. Has been doing that during closure.
We have.
So that is an example of clean. And then obviously continue cooperating. Even though school is closed, you still need to be having conversations with your local health department partners, your judge executives, your mayors. You need to continue that communication, because issues will continue to arise even though we're not having students in our buildings for the next few weeks. any questions related to the public health side?
Not yet, not quite yet.
Okay.
Okay.
And Dr. White, we welcome you to stay with us as long as you can. We know you have other things to attend to.
Well, actually, there might be one here that might be directed. So what directives are being given to local organizations who provide social support? So YMCA, daycares, boys and girls clubs who will now be overwhelmed with children in terms of from a health department standpoint.
Well, we go back to the social distancing. If you call off school and everybody shows up at the mall hanging out, that's not social distancing. If everybody goes to the Y and hangs out, there's going to have to be some altering of the activities at the Y. If everybody goes, if you go to the public library and go and pick up a book and leave, that's one thing. If everybody hangs out around the water fountain, that's another thing. So there's not a number of people. It would be great if I could say this many people can get together, but this many people can't. People are going to have to use some judgment. And every time I think about this, I think about that curve, and I think about where do I want to be. And I would err on the side of if there's a way you can do something outdoors where kids aren't on top of each other together, like the commissioner said, you don't want to close school and find practice going on. We're going to have to do some very unpopular things, especially with our teens, because they like to group together and they also like to do social media things, as long as we can make sure their message isn't wrong. I think the YMCAs and the daycare centers are going to have to make some tough decisions.
And again, superintendents, and to reiterate, during closure, if you're doing an NTI day and your certified staff are telecommuting and no other staff are reporting, other maybe than food service, then that's probably the ultimate in social distancing. If you're doing the traditional closure and nobody is reporting to any of your buildings, or a number for maybe food service, that is the ultimate in social distancing. If they're telecommuting, or if they're just reporting for food service or others, a limited amount. If you are requiring folks to come into your buildings, you need to answer the question of social distancing. And there should not be gatherings in the auditorium. You need to really understand that over the next few weeks, social distancing, that is the key term here, and everything you're doing, you need to be making sure that's occurring. And then if you have questions about that, or because you are bringing your cafeteria staff in, for example, and you have questions about issues related to their interaction because of the virus, then make sure you're talking to your local health department officials to give you some guidance on those issues that may arise.
I mentioned the letter that we sent to them.
Yes, I do want to, today around noon, or I think around 12:14 actually, I sent an email to all superintendents that gave you the sign-in for this webinar, but also, most importantly, it attached an example letter with language that you may utilize in sending to your families and your community regarding closure. This letter was drafted in conjunction with the Department of Public Health, so it has some information in there on the public health side. It is not mandatory that you send this letter or you use this letter. I know and I apologize that we just got that to you around noon, but and many of you have already sent similar letters, but you are certainly welcome to use that language and take that letter and customize it as you determine necessary. But please know that it was created in conjunction with public health. So the information in there regarding the public health, the issues, those are coming from the experts at Department of Public Health.
Okay. All right. So our most popular questions are in regards to NTI days. So when will we know if we have a waiver to add more NTI days, if we have used the majority of our NTI days already for weather?
So many of you are you have the 10 NTI days by statute. We will not know until the General Assembly acts. We do know that they are aware of this issue, that we are all indications, we have support in the General Assembly to increase the number of NTI days. It's just a matter of when that is passed, either through a bill that's currently existing, through possibly an amendment to that bill, or inserted into the budget language. So it could be as late as April 15th, which is currently the last scheduled day of the General Assembly, or at least constitutionally that it has to be the last day. Worst case scenario, if for some reason the General Assembly did not increase the number of NTI days, we'll be asking the governor for an executive order to increase the number of NTI days available to you. So I'm going to just go out on a limb and tell you, districts, if you're bumping up against your 10-day limit that's currently in statute, I feel comfortable with you going to 20 days total at this point. That is a commitment that we have. The governor's office is committed to increasing that number as well. Everyone we've talked to in the General Assembly, they are committed to that as well. So I feel confident that we will have relief in that area.
Is there any current knowledge of the status of House Bill 461? Lets district close for 30 days using NTI and gives staff 30 emergency days, is what the question says.
I believe the elements just described in the question, I believe those are in a floor amendment to 461, and there's a lot of chatter on social media about 30 days and emergency days. Just know these are proposals, and there are a lot of proposals floating around. We still have quite a bit of time left in the General Assembly, and we know from previous experience when we've had a lot of adverse weather days in previous years of the General Assembly, generally the General Assembly addresses the types of emergency issues in the budget bill, and in most years the budget bill is not finalized until the last few days of the session, and so that may be the case this year. So it's too early to say what that means. There's just a lot of discussion. A lot of folks in the General Assembly and others, advocacy groups and the K groups, have ideas about relief they may want to see happen. That doesn't mean it will happen or that it would be in any specific thing suggested now would be what ends up in a budget bill. I believe there will be something in a budget bill, and if not, I believe we will see an executive order. I just don't know what that looks like. In previous years, for example, the General Assembly has said districts shall not be in session past June 12th or June 6th. And again, this is previously, the General Assembly has said this previously in dealing with a lot of adverse closures for snow. That's an example of something that they could do. But we just don't know what that looks like yet, and we're learning as days go on about, trying to understand how many days we're going to be out. And so just know that we're having conversations with the General Assembly about that issue. Your advocacy groups are having conversation, and I know you as superintendents will be having conversations with your General Assembly members, I'm sure this weekend, as they'll be back in your communities.
Okay. This one we've kind of addressed, but there's been 5 people who've asked a similar question. Specifically, do you recommend staff to come in during NTI days, or would it be safer to have them work remotely?
Ideally, and this is consistent with what the governor said, it would be best if folks worked remotely, because that is the ultimate way of ensuring social distancing during this time. However, we know that may not be the preference in your district or feasible. And so if you do not have your folks working remotely, then you need to make sure social distancing is the number one thing you're thinking about when they come into your building.
Okay. Our spring break is the week after the KEA spring break. Should we postpone our cancellation until the following week? That was asked by 4 people.
So they would have to go in, they would be off for 2 weeks, go in for a week, and then be off again. So that hits a lot of our districts.
Okay, so the question would be, I don't have a calendar, I probably needed a calendar in front of me. So they would be, this district's asking, we're going to be out for the next 2 weeks based on the governor's recommendation. We would then be in a week, and then we have our spring break. My recommendation is that you obviously plan on being out for the next 2 weeks, and you will be out for the next 2 weeks. At the beginning of that second week, we will need to have a conversation with you. We will know more about this. We will be having conversations with the governor's office and the Department of Public Health, and then we can advise you as to that third week before spring break.
We are concerned about classified staff ability to fulfill their contracts before June 30th. Can we grant additional emergency, in parentheses, non-work days to these employees?
I think the best answer is, as an example, Dr. Burchett, could you read for us the letter you sent to your community about, and you touched on that very issue.
Just one quick second here. So this was in my initial, or my email yesterday and message to my staff yesterday, which touched on our being out this next week, and with certainly believing we would have extended closure on up through what is our traditional spring break, which is the first full week of April. But I closed with this. I want to ensure all employees that there is no danger of loss of wages during this time. We will be continuing on a work schedule similar to what we've been doing this week. Teachers will continue to develop and support instruction. Food service will continue to prepare and provide meals, and all others will have duties assigned as necessary. All employees will have the opportunity to work and complete their contracts in some manner now and or before the end of the fiscal year, June 30th. These NTI days are instructional contract days and serve to help fulfill those contracts. Most importantly, we will continue to meet our prime imperative of providing for the safety and well-being of our students, staff, and community. We will also continue to provide continuity of instructional and nutritional services. More information is found in the attached letter, and further information will follow, which will be targeted to those with specific roles. So we look at it from a role-based support structure, be that nurses or mental health and wellness professionals. One thing we initiated today in our plan was to incorporate a hotline for our students for mental health and wellness. And my school psychologists, counselors, social workers are all a part of that team, which will support that. Students can call that number. It's on our website, and reach someone live. So those are it's kind of the out-of-the-box thinking that we're trying to do to ensure that we meet, that we work through this as best we can and provide those services to students. Our community needs us to lead in a positive manner.
So you'll see in Dr. Burchett's message to his district, he was not counting on any kind of emergency relief or for however another term you might describe it by the General Assembly. Something may happen. There may be some type of emergency relief or relief that affects classified employees. You know, I think it's too early to speculate what that might look like. So before that happens, or we know what that might be, if there is any type of relief, you're proceeding just like you would be proceeding if you were out for a blizzard for 2 weeks, whether you're using NTI days or traditional closure days.
Dr. Burchett, they've asked if you can share that letter with them, so if you want to send it to me, I can forward it on, or
I'll put it on KASA's portal. All superintendents have access to that.
That would be helpful. They also are asking, how is Harrison County funding their food service program during these days? They've heard a lot about it, the drive-through, people coming through and picking up food service. How are you doing that?
Well, that is at the local level right now. And I discussed individually with my board members and just with a phone call, and I said this is what we have to do for our students, and of course they're 100% supportive of that. That is not official. We've not met had an official board meeting, and we will go back and deal with that in the future. But we will continue to meet the needs. These are unprecedented times. We've not seen anything like this as educators or as a country in many years. I think probably back to the Spanish influenza in 1918. So,
and I'm going to put a little pressure on the U.S. Department of Agriculture here. I hope you're listening. Dr. Burchett made that decision out of the best interest of the students in Harrison County, based on the full faith and credit of the United States government, that they will hopefully respond to our waiver favorably in that we are attempting to provide, and we are providing, food service to students in a non-congregate setting that is appropriate for a waiver. And we are doing so in an unprecedented time, all the more reason for the waiver to be granted. So, and we are in conversation with U.S. Department of Agriculture. There have been a lot of emails going back and forth. We're a little unique, and I know other districts, other states around the country have similar days, such as NTI days, but they're wanting to make sure that they understand the difference between an NTI day in Kentucky versus what I call the traditional closure day. So we hope to have an answer back from USDA shortly.
Okay.
And I think Angela and Robin have my cell number. I need to get back, but text me if you have any questions that come up in this
Thank you.
afternoon.
Thank you
Sorry
so
to-
much
sorry to have
for-
to leave.
Thank you so much for your help. We have a couple of questions with regarding special ed. So I think Greta, you'll be up here in a minute. Do you anticipate extended deadlines from the U.S. Department of Ed regarding sped deadline for evaluations or ARC meetings / IEP deadlines? Kevin or Greta?
So we have actually been in conversation with the U.S. Department of Education about these types of things because we know there's a lot of angst out there around deadlines, and we understand that there's a need for flexibility both at the SEA level as well as the LEA level, and we're awaiting guidance. It's important to keep in mind that the IDEA itself does not allow for extensions based on exceptional circumstances, even in nature such as these. And so the FAPE must be provided to students with disabilities. However, one of the things that we're saying and that USAID is sharing with states is that the important piece during this time right now is to ensure that you're providing equitable access and opportunity to students with disabilities in the same manner that you would students without disabilities. If, in looking at students' IEPs, we would expect that comparable appropriate services would be provided. We also understand that districts are not going to be able to have, thousands of IEP team meetings prior to going into NTI days or school closures. However, when things return back to normal, we definitely would expect districts to be having those IEP team meetings, looking at the amount of services that were provided, the amount of services that were not provided, which would require districts to have a very solid progress monitoring system during this time, as well as data collection method. And so we would look at when you reconvene and have those ARC meetings on the back side of this, when we get back to normal, did you look at the progress monitoring? Were students provided FAPE? What services were missed? And then how do ARCs provide, plan for and provide compensatory education? We realize there's going to be compensatory education in these situations, and that's a unique case-by-case situation for every kid with an IEP.
Okay.
While we're waiting for the next question, and I think the question of the day, is the difference between NTI days and a regular closure, and what should teachers or other staff be required to report to buildings. I just want to read what Governor Beshear said this morning in the press conference. If teachers can work from home during this time, then let them work from home. Beshear said Friday morning, if we can cut down on numbers of people in schools, then so much better. So what he is saying is you need to ask yourself the question, if I normally would have teachers in the building during an NTI day, for example, how could I cut down on the numbers of teachers or others in schools during this time? You just ask yourself that question. If you think you can get all teachers telecommuting, and you have deliverables for them, and they have their laptops and cell phones, access to students, or whatever they may have if they were sitting in your building, then the governor is encouraging you to do that. We're saying to you that that is certainly appropriate under NTI. If you don't think you can do that for whatever reason, then we are asking you, and the governor is asking you, to cut down on the number of people in schools. And if you have folks in schools, you need to make sure there is social distancing going on. And then for those folks that are in schools and you have questions about direct contact between employees, you need to be consulting with your health department.
There's a question asking about how the Department of Education is going to be handling the recommendation if there's going to be less staff here at the department.
The Department of Education for the last 10 years, and this started under Dr. Holliday, we have been engaged in telecommuting or limited telecommuting at the department for at least the last 10 years. So we will be we will be providing services to the state regardless. And so on a normal day at the department, if you email someone, they very well may be telecommuting. Or if you call someone, it rings. You think you're calling them at the department, you could be calling them at their home office. And so we don't anticipate a reduction in services to our school districts during this time.
Is it necessary to submit the summer food service program application prior to serving meals beginning Monday?
I'm sorry, could you just repeat the question?
Is it necessary to submit the summer food service program application prior to serving meals beginning Monday?
No, we're making some exceptions to that. If you can reach out to the Division of School and Community Nutrition, they will help you in completion of your application and getting that expedited.
Has there been conversations with the College Board concerning AP test dates, and any conversation with ACT concerning the April 4th test date?
So ACT and the College Board have not suspended testing on those dates as of yet. They are relying on the test centers. If the test centers are closed, then they will rely on the local districts to determine if they want to continue with the testing. ACT has indicated that they will contact schools, test coordinators, as well as students impacted by any suspension or closing of the test center. So I would encourage people to watch the websites at both ACT and the College Board.
Okay. In addition, Kevin, why don't you mention the state testing on ACT in the districts that?
Sure, and we know that, you're talking about ACT or KPREP?
The ACT for now, and then we'll get to KPREP after that because that's been asked as well.
Okay, I thought you answered ACT.
No, our statewide test, the date, with the districts that have to
The
make
March
up.
24th date which is the makeup day for ACT, the first day was March 10th, I believe, for ACT.
That's correct, this
Makeup
past
day is
Tuesday.
March 24th, which has been canceled. We will continue to have dates as we go forward into the spring for ACT to make up for the makeup day, correct?
That is correct. We had a webinar yesterday with our district assessment coordinators, and we announced some new dates. We have an emergency makeup date of April 14th for students who are testing on paper. We also have an accommodations makeup window of April 14th through April 24th. So if our special needs students need to make up, they have that window as well. Now, there is an option to move to online testing, and those dates are April 14th, 15th, 16th, as well as April 21st, 22nd, and 23rd. So there are multiple opportunities to complete ACT testing.
And we might as well just talk about KPREP testing for the state assessment and accountability program. We are hearing, and it's been reported by various Education Week and others, that U.S. Department of Education may be offering waivers related to state accountability and testing under their state plans as approved by U.S. Department of Education. We don't know what those look like yet or what those would cover. I can tell you that we will take full advantage of any waiver offered by the U.S. Department of Education for our assessment and accountability system.
That is correct. We had a conference call with CCSSO, and they had representatives from the U.S. Department of Education yesterday afternoon, and they announced that there would be specific targeted waivers for schools that are closed during the entire assessment window. So we will obviously monitor the situation and see if schools continue to be closed after this initial closure, and we will take advantage of all the waivers that are offered by the Department of Education. At this point, for K-PREP testing, we are planning to hold for a few weeks the materials shipment. So as I announced yesterday, before the governor's announcement that we were going to go ahead with the shipments, that's been changed based on the governor's recommendation for closure, and we will hold the materials shipping for at least 3 weeks. So we will work with our district assessment coordinators with that specific information.
Okay. We've had a couple of questions that want to know an updated list of how many schools have closed. As of right now, we are keeping a live timestamp. We have 128 of our districts as of right now, which is 2:30 p.m. 128 districts have announced plans to close at least temporary for the next 2 weeks, at least the next 2 or 3 weeks, starting Monday.
And again, superintendents, and I'm not saying this to be punitive or any other reason, I have an obligation to the governor and the Department of Public Health to report today the number of districts that will be closed either Monday or Tuesday. And those 4 districts that are closing or beginning their closure on Tuesday, they need to get their students in there to get supplies for non-traditional instruction. I need to know if you are not, please email me directly, kevin.brown@education.ky.gov, if you are not closing based upon the governor's recommendation.
Our next question is going to pertain to more on NTI, and we were wondering if there was going to be, if the state board was still going to meet on the 18th, and that is correct?
That is correct. The state board will meet on March 18th. That's a special meeting designed to select a search firm for the next Commissioner of Education. I can tell you, I think that meeting should occur, and they should select a search firm for the next Commissioner of Education. That meeting was going to be in Louisville because the search firms we anticipated would be needing to fly in, and so that was there for their benefit, and they wouldn't have to rent a car to come to Frankfurt. We anticipate that meeting will be moved to Frankfurt. And then, of course, that meeting will be webcast, and we want to make sure that folks can view that meeting, but they don't have to be here. We can practice social distancing. So there will be a meeting announcement, an official announcement of that meeting in the next, if not today, on Monday.
Why can't 21st Century Learning salaried staff employees work on NTI days? We've received guidance that they cannot be compensated through the grant, but these are student days in which they can help provide services. And that's been asked 3 times. Why cannot 21st CCLC salaried staff employees work on NTI days? We've received guidance that they cannot be compensated through the grant, but these are student days in which they can help provide services.
I don't think we have an answer to that question. We will get the answer to that question. It will be on the Q&A document. If we don't give you an answer on the webinar, we will put that in the Q&A document.
Are there recommendations for financial obligations during this time if finance staff are not reporting to work?
Robin, you want to take that?
I'm sorry.
We're multitasking here, so sometimes we have to repeat the question.
Are there recommendations for financial obligations during this time if finance staff are not reporting to work?
Are there recommendations for
Financial obligations. Basically, what are they going to do if their financial staff don't report to work?
I mean,
If
to
they're-
pay the bills and that type of thing?
Yes, that's what I don't know. I'm guessing what are their obligations? What are the recommendations for their obligations? If whoever sent that question would like to resubmit that and maybe be a little bit more clarifying in the question. And we'll get back to
Bills
that
still have
one.
to be paid.
You would, and I would also point you to your continuity of operations plan. You should have that in your district. If you do not have a continuity of operations plan, then by all means, when things return to normal, you need to have a continuity of operations plan. In the meantime, you'll need to develop a plan for example, if you have central office employees that need to be off to take care of a sick relative, or if you need to, you have to continue the functions of your central office, and so you'll need to make sure you have plans in order to provide those services.
Yeah, and anything that they can handle, obviously remotely, if they can pay bills remotely or anything like that, they need to do that.
And there again, it may be a foreign concept to your district if you've never had telecommuting, or if you've had folks in a position that you never thought would be eligible for telecommuting. That with technology that we have now, the cloud-based systems that we have as a result of our Office of Education Technology over the years, and we've been a leader in that around the country. We are really well positioned to be working from home in these types of situations. So we're happy to guide you offline through a technology lens or other personnel. We have experience here at the department in telecommuting for the last 10 years. So if this is a new concept to you, and it will be for many of you, then we're happy to walk you through that.
Okay, so this question keeps popping up, so somebody really, really wants to know. It's for Dr. Perchette. How do you, can you please explain how you're handling the food distribution to students across the county? Are students coming to set locations? Are there deliveries to home? Please share.
So, well, if you want to grab my Twitter feed, it's at Dr. Burchett _HCS. We have stuff up on that. We have some things on our website, I believe, as well. We have two sites. Our Harrison County High School is operating a food service site, and so is Northside Elementary School. Both of those have, we practice safe social distancing. We have drive-up pickup at those sites. Of course, our staff is gloved and have proper equipment. We also are utilizing our transportation department and bus drivers to deliver meals to certain locations. We have a call-in registry set up so that students can call in and get listed on a Google Doc that they need meals provided, and they have no means of getting to those sites to pick up those meals. And our transportation director has quite efficiently routed transportation with bus drivers, and we use other instructional support staff. It could be an instructional assistant, could be other folks or other bus driver or a monitor, bus monitor. So we're using our people to effectively meet the needs of our students and our community. Again, you have to think outside of the box on this one. This is not what we normally do. This is not our normal NTI. Our NTI plans were never designed for this, but we are ramping up into a different style of learning and support that we're not used to doing. And I would just encourage you to be very open. Listen to your folks. They've got amazing ideas. Let your people lead. We're empowering our people to lead and come up with plans and ideas and work on solve these problems together.
Thank you. Completely agree. I do want to say I know I'm getting some emails from some superintendents. I know there's frustration out there. I know you feel like you are receiving mixed messages, and we're saying to permit telecommuting, and the best way to have social distancing is to not have anybody in your schools, but we're also then encouraging you to have food service. We're encouraging you to deep clean your buildings. We don't want that to be a mixed message. What we are saying is there's public health benefit, for example, to have food service. If you have food service, you do have to have some people in your building, your food service folks, to fix the food. However, if you also have your teachers in your building, even though they're sprinkled through the building in their classrooms, that's 25 more individuals in your building. So let's reduce, if we can, let's reduce that by 25. The cafeteria workers, the food service workers, we need them there. So let's take the 25 teachers and let's permit them to telecommute if we're using an NTI day. And that gets 25 more out of the building. That's what we're saying. If that's not feasible and you're not comfortable, as we've said, with them telecommuting to effectuate NTI, and you have the 25 teachers plus the food service staff, then you need to make sure that they're staying apart, that they're in their classrooms and they're in their offices, and you're not having an assembly in the cafeteria or the auditorium. So it does seem like a mixed message, and I know we're asking you to do multiple things, but I hope that provides a little bit more clarification of what we hope that you do.
Will students on home hospital still be required to have a visit 2 hours a week? Will we get credit for them on NTI?
So, as many of you all may know, we do have a bill proposed for home hospital to address the issue about the visits that are required. We do feel in this very extenuating circumstances for just general students, and I'll let Greta and this kind of the special ed side speaks to the special ed population. But for general students, we are comfortable with visits either being electronic or by telephone. So we'll let that kind of play out just because of these very extenuating circumstances that we're in right now.
So for special education students, I agree with Robin, considering the exceptional circumstances that we're in. It goes back to what I was saying earlier about comparable and appropriate services. Obviously, we want to keep families and students safe and healthy first, and staff. And so, when we come back to the normal side of things, that'll be the question is, did you provide the services, and was there reasonably calculated free appropriate public education in which the student made progress? And if not, what comp ed services do you need to provide?
Someone else would like to know a little bit more about school nurses and how they're being utilized during school closures.
We're going to ask our school nurse consultant, Angie McDonald, to come forward.
Okay, right now that is kind of up to the district, each individual district to decide. I'm hearing various things going on over across the state. Many who are fortunate to have school-based health clinics, which have a nurse practitioner, a physician's assistant, or whatnot. Most of them have reported to me that they are going to stay open, business as usual, and encourage families that if you just have concerns, please come to them first. They want to try to lessen the burden on the emergency rooms and doctor's offices. Some districts are still just having their school nurse offices open for families that are just concerned. Do we need to go to the doctor? Is this something that they might be able to provide some medical advice for? We've had some that are working out some things that are helping out with their local health department. I think it's just kind of up to the individual districts as to, what they're doing. If nurses are willing to come in during this time, then, I believe we should take full advantage of the services they can provide to the kids and kind of think out of the box. Like they said, some I know are even delivering medications to students who have daily meds and don't have transportation to get to pharmacies or whatnot. So these are things that are, like I said, out of the box, and I'm happy to, help brainstorm with anyone if they'd like to, discuss it further.
Okay, this one is going to be for Robin with summer food service program. If meals are delivered door to door at home addresses, do we need to enter each address as a separate site, or can they all be listed as a site at the school building?
I don't know the answer to that right off the top of my head. I'll consult with Lauren Moore in School and Community Nutrition and get an answer so we can reply back.
Okay.
I would just like to follow up on Angie McDonald's comment about thinking outside the box. I completely agree. We've talked, since I've been working at the Department of Education since 2004, we've often talked about thinking outside the box. We need to give districts more the ability to innovate. This is the time, folks, to think outside the box and innovate. And so we're more than willing to hear your ideas if you have a better way of doing something during this time, and we're willing to work with you and cooperate with you to be as creative as possible if it is in the interest of kids and your staff.
If we have employees who choose not to work at this time, are they able to take a sick day for that time?
Yeah.
Yes, Todd, do you have a thought on that?
Can you repeat the question?
If we have employees who choose not to work at this time, are they able to take a sick day for that time? I guess the assumption is that they're not sick, but they don't want to come into work for this particular reason. Are they able to take a sick day in order to get paid for this time?
So sick leave is supposed to be used for either your own illness or to care for someone in your immediate family who's ill, and state statute provides that upon return, an employee is either going to provide a doctor's note or they're going to sign an affidavit saying that they were either sick or they were caring for someone in their immediate family who was sick.
So assuming that their absence fell under the sick leave policy, then it would be permitted.
Another question about which KDE departments are going to be operating at full capacity or functionality over the next 3 weeks.
We will be operating under full capacity, and we'll be operating as the best we can, and just like we are at any other time during the year.
I would say that we are going to implement the telecommuting policy very liberally, just like we're encouraging local school districts to do that. So we may not all be on site here in the 300 building in Frankfurt, but we will be at full capacity.
And as we have more employees that may roll on to telecommuting that may not have telecommuted before, there may be a few little hiccups with their phone may not initially be transferred to their remote location, but so there may be a few little hiccups, but we will be here to provide services.
We have directed teachers to make 10 days of NTI instruction to get through 2 weeks. Any guidance on if we should advise teachers to do more than that, given a potential extension of this current 3-week outage?
Kelly, do you have a thought on that?
I just think you ought to go ahead and be prepared. Why would you not? I mean, you just made the comment, Kevin, that we're probably going to get more days, so I don't know why a district wouldn't be prepared for, Dr. Burchett could, if I give you 10 more days, you want your teachers to already be prepared.
And that's what we're doing now.
Yeah, right.
So our normal NTI plan was already developed online and packets made. We send home days 1 through 5 at the end of October, 1st of November for weather-related situations. We didn't have any weather days that we used NTI on this year. So we started with day 1 through 5 this week. We've got 6 through 10 ready for this upcoming week, but our teachers now are doing days 11 through 20,
Right.
and our instructional staff. So that's how we're handling that.
And this has brought up an idea, so to the extent you're needing to, principals will need to meet with teachers to discuss maybe additional plans, curriculum for additional NTI days. David, I hate to put you on the spot, but you're always good at this. Can you talk about some options available through technology such as Microsoft Teams that can facilitate, for example, principal communication with teachers to virtually meet and have these discussions?
Yeah, as you mentioned earlier, we've been well positioned for cloud-based computing for quite some time. We've done our financial management system. Of course, our school information system is cloud-based and has been. Our email system and everything that comes along with Microsoft Office 365 and Google is also completely cloud-based. The learning management systems that come with both Microsoft and Google are also completely cloud-based. People are familiar with maybe the Google Suite and the Microsoft equivalent, but also Microsoft Teams. Google has an equivalent that allows telecommuting and teleconferencing. Pretty sophisticated tool that's been launched. We've been working with their ed tech leaders and CIOs on this for quite some time. Obviously, we're implementing that here in Katy, the agency. But I think all these, along with PBS Learning Media and the other tools that are out there, allow them to provide content and communication and administration during this time.
Right. Now may be a good time to go to Dr. Sweeney to give us some guidance on mental health issues.
Sure. Good afternoon, superintendents. I'm here to remind you of some of the social and emotional concerns that need to be considered during this time, along with giving you some best practices for your mental health practitioners. So we already have reports of students who just can't sleep at night because they're so anxious. So in order to help children cope with this anxiety, we've really got to work to provide accurate prevention information and facts without causing undue alarm. They need this factual, age-appropriate information about the potential seriousness of disease risk and concrete instruction about how to avoid infections and spread of disease. As a reminder, children will react to and often follow adult verbal and nonverbal reactions. So if they see us being calm, they will be calm, but if they see us overreacting, they'll follow suit often. What you say can either increase or decrease student and teacher anxiety as well. As superintendents, it is also important that they know they have someone who will listen to them and make time for them. And I would say that is not only the case for students, but also for some of the staff in your buildings that might be scared. For your students specifically, remind them to avoid stereotyping, and that bullying or negative comments made towards others should be stopped and reported to the school district or the Kentucky Office of Homeland Security at 866-393-6659. Students and parents may also choose to report online at homelandsecurity.ky.gov/safeschools. We should also teach students to be upstanders. So, as you can imagine, we have some students exhibiting bullying behavior and creating some negative stereotypes. And when we see that, I think it's really important for us to remind students that they can be upstanders, and if they see something, especially on social media or in person, they should say something. For more information on bullying, check out KDE's bullying and harassment page. Also remind parents to limit television viewing or access to information on the internet and through social media that might be upsetting or produce more fear for their students. In terms of some best practices for mental health professionals in providing continuity of services, you may need to consider changing contact information on the school website or school counseling page so families can get in touch with your mental health professionals, whether it's school counselors, school social workers, or school psychologists. If your district policy permits, we can also go to the telehealth model. So you can use Google Forms. You can have students sign up for appointments with that mental health professional at your school. Those folks can use Google phone numbers, which are anonymous. They can also use Google Hangout, or as Dr. Couch said, Microsoft Teams, if you'd like to see one another, if those professionals would like to see the student as they speak. They can also use a site called doxy.me, so DOXY.me, which is a free HIPAA-compliant service for telehealth and no accounts needed for students or families. Finally, one concern that I have as a resource for school counselors throughout the state is that many of our counselors say that they're too busy with other tasks assigned to get into classrooms and do those school counseling curriculum lessons that will allow them to provide information proactively. So we would certainly encourage counselors to do video school counseling curriculum lessons to help students better understand major themes within the 3 pillars of school counseling. Those themes are academic, career, and social emotional. They can also ask students to respond to those lessons. Finally, We would ask that students use their data, that school counselors or other mental health professionals use their data. So ask yourself, what interventions can we follow up on during this time based on our attendance, our behavior, or our course passing data? Can you call your families of students with chronic absenteeism? What about those families that have students with multiple disciplinary referrals or students who are on the verge of failing courses or being retained, and have conversations, again, proactive conversations to get in front of some of the issues I just mentioned. Remember that these folks are and have always been school leaders who provide stability and comfort. We need our mental health professionals in our schools to know how valuable they are during this time. Earlier today, around 12 p.m., I sent out a counselor connection. It's got many resources that you can use, your district can use. Some of those resources include communicating information about this virus to multilingual families. You also have information from the American School Counseling Association. There will be a webinar that I'll host on Wednesday at 1 p.m. for our school counselors and mental health professionals as well. That link to sign up is in that counselor connection. So if you have any questions, feel free to reach out. I'm here as a support to anybody, whether they're a mental health professional, school counselor, et cetera. I want what's best for our students, and I certainly appreciate everything that you do. Thanks.
Thank you, Dr. Sweeney.
So I have an answer for the summer food program, where the question was, if districts deliver door to door, do they have to enter each home address as a separate site? Yes, that would be required with door to door delivery. However, in the guidance that we are sending out this afternoon, we are recommending that districts who would like to deliver would utilize bus stops in order to minimize the work that would be required related to applications and delivery. So I can repeat that one more time. Yes, that would be required with door-to-door delivery. However, in guidance that we are sending out to districts this afternoon, we are recommending that districts who would like to deliver would utilize bus stops in order to minimize the work that would be required related to the applications and delivery.
And I just want to point out, and Robin, correct me if I'm wrong, but the requirement that you enter those addresses, that's not a KDE requirement. That is a requirement of the U.S. Department of Agriculture.
That's correct.
And I want to turn it over again to David Couch. He has a few more things to say regarding technology.
Yep. So I talked about the cloud-based services that you can get access to anywhere, but I did want to let the districts know, and anyone else that may be watching. There's also, we have put out digital learning guidelines. And so this is a web link to kind of help you during this time if you've not done it before. So this is a good way for you to kind of learn about the digital learning environment that we have and the guidelines. But also, we put this up for quite some time, the digital readiness of every district. So you see cumulatively where we're at with our state, with our schools, but also within the home area as well, where this NTI comes into play. So you can have access to what is the percentage of home access, what are the learning management systems that school districts use, what are they one-to-one, can they take devices home, or can't they take devices home? So I think those three services, our cloud-based, our digital readiness, and digital learning guidelines will be very helpful to you during this time.
Great, thank you.
I have a CTE question for our ATCs. So working at an ATC, do CTE teachers report to an empty building, or do they telecommute with NTI? Also, what about secretarial staff at ATCs? Report or telecommute? Thanks.
Okay. Tom Thompson has been working all day with personnel, and we're getting information from all our centers, and we're getting communications out to each one of you by today on what will happen in each ATC, because what's happening on the ground with each school district is different from district to district. So we're going to let you work with your local district, as we did in Harrison County this week. So if you haven't heard your plan by this evening, email me personally and I'll get someone in touch with you.
Want to do something? I can give you I'll give you an update on our districts here. They were asking for an updated number, so I'm going to refresh the page.
We're going to get you an updated number of districts that have announced closure beginning either Monday or Tuesday.
our staff has been inputting these in as they've been reporting. So we don't really have a mechanism. So we've had to input these in ourselves, which is why it's not that they've just reported, it's that we've had to input them ourselves. So as of right now, which is 3 p.m., we have 151 of our 172 districts in Kentucky that have announced closures as of beginning Monday, at least of 2 or more weeks. So again, 151 of 172 of Kentucky's school districts have announced closures of at least 2 weeks beginning on Monday.
And of course, we also announced the closure of the Kentucky School for the Deaf and the Kentucky School for the Blind. I think those notices went out this morning or last night.
Yes.
Yes, okay. What other questions do we have?
Let's go back over here. There was questions, communications questions and hashtags for NTI work. I guess that would be my area. We don't really have a hashtag for NTI work, but if you would like to share that with us, or do you guys have NTI?
Well, we have one that you guys designed for us, but it was more for sharing out, like, this is a great thing we're doing with NTI, more of a publicity thing. We can probably create one that's specifically for this. And I wanted to remind you about letting them know again about the KET.
Yeah, I would love for you to share that.
Yeah.
And we would love I absolutely want to see what you all are doing with NTI work this week. And please share that with us on our social media channels, because I think it's really important for the state and for everyone to see the innovative ways that you are doing instruction with children in this situation. So please, please, please share with us. I know we have your applications and we're going to be looking through those and we'll be following up. But from a communication standpoint, I really, really, really can't reiterate enough how important it is for us to see and really know the work that you're doing. And I want David to talk about the partnership we have with KET.
Right. So the hashtag, by the way, is just MY, capital M, small y, and then NTI, all caps, KY, my NTY, KY.
Hashtag my NTIKY.
And then KET, in conjunction, it's another part of the digital learning, has opened up some resources that they normally don't give away through PBS. And they have actually created a email address that is simply nti@ket.org. So they've got a specific email address for questions about how to use their resources on NTI days.
Sounds good. And then also, just a good reminder about overall communications. There has been, a lot of miscommunication out there. Earlier this week, there was a tweet from a fake tweet from the governor's account. I think it's really, really important that you make sure that as superintendents and school districts, that you're really make sure that you're following, the Department of Education, the governor's authentic accounts. Make sure that you're clicking on the actual accounts, and just do a double check to make sure that those are actually tweets that are coming out. We have a lot of innovative kids and other people who I can speak from personal experience with snow days that like to have extra days off. And it's just really important that we get the correct information out there. So it's really, really important to make sure that you're checking the source. And we will do our best here at the Department of Education to give you the most accurate information. So check our Twitter account, check our Facebook account. You can always contact the communications department here. I'm always available 24/7 if you have any questions about, whether something is accurate or not. If you have a question, just always text me. We will verify that for you before sending out any kind of information. We really had an issue earlier this week with that one particular tweet. So I just want to remind you of that.
One question, did we address the question, Greta, about initial reevaluations in special education students?
Yeah, we understand that there's going to be situations in which districts miss those timelines. It's, as long as it's an NTI day and school is technically in session, then it's an instructional day and the timelines are still in play under IDEA. So if you miss those timelines, it's still an out of compliance, for lack of a better way of saying it. If school's closed, then the timelines, that's not an instructional day, so it's not counted as part of those 60 school days. Again, we're seeking flexibility. I don't know how that will look. And this may be one of those situations where you're missing those timelines, and then you're looking at it on the backside on what those services may look like. There's really no way to go back and remedy a missed timeline. You can't go back in time and correct that. So it just is, yeah.
And I'm going to take, we'll probably just take one or two more questions here. I was told that President Trump is holding his a news conference here shortly. And we will wrap up some of these questions. And again, we'll provide them. We're working right now. We're putting them into a Q&A format that we will send out to you via email. We're also working on a Q&A that'll go out on our website for families and communities that we will share out via our social media. The last question that I see here that I don't know that I've had here is there a chance that hourly employees will just have their makeup time waived via legislation? I'm thinking about bus drivers, et cetera, that just will not report.
We addressed that question a little bit, and that it's addressed. Initially, you need to be handling it similar to how Dr. Birch had handled it in Harrison County. He's going to provide the letter that he sent to his community and his staff on the KSA or the KASS portal. Mm-hmm. So you can view that letter. That gives you a little bit of how he's handling it. I can't speculate right now what relief may be provided by the General Assembly. And I don't know what that would look like. There are some proposals out there about 30 emergency days, so just don't let that confuse you. What could be in a proposal on a floor amendment pending in the General Assembly that may or may not pass. So continue to talk to your members of the General Assembly if you have ideas, of course, but we can't speculate right now as to what relief may or may not occur through legislation or an executive order.
So I've received 3 or 4 text messages asking if we have to stop for the president's address. Because this one question was, the timelines are still in effect with the ARCs. We can't go back in time and correct them, seeking flexibility. They will send out a Q&A. That was a question.
Is the question whether or not we are going to send out a Q&A? Yeah. Yes, we're working on additional guidance. We actually spoke with OSEP Director Lori Vanderploeg this morning, and she informed me that USAID would be sending out additional guidance. So as soon as we receive that, we will update, particularly directors of special education as well as superintendents. So the SEA doesn't want to get ahead of that, obviously. So as soon as we hear something, you'll hear something.
So to the extent we continue to have questions coming in from superintendents, I've pledged that we will continue to answer those. When the president does come on, we will just say, we will let you know that is going on, and you have the option of, jumping off this and watching if you want to do that. We'll have folks here go and monitor that. But as long as we have any questions coming in, I want to continue that.
So
And just also know that the governor is likely to have a press conference
around 5 o'clock.
Around 5,
usually.
and we will stop for that. Nothing against the president, but the governor will have things that is very much more directed to that he may say in his press conference to what we're dealing with right now.
For schools that are not using NTI and are just closing, is it possible, do you think, that lawmakers will consider just waiving some of these days because of a state emergency? I guess the question is will they have to really make these days up?
Again, we can't speculate. We do know just from history that the General Assembly, when we have had an abnormally large amount of closures during the winter for adverse weather or the flu, the General Assembly has generally always provided some type of for lack of a better term, relief in the budget bill or other legislation to address that, to address the issue of potentially having to make up days going into the middle of June. We don't know what that looks like. I feel certain, because of the situation we're in right now, that there will be some type of legislation, budget language, and if not, some type of executive order to deal with issues that may exist as a result of this. So again, can't speculate. There are many ways to do that, and as I said earlier, the General Assembly has dealt with it in several different ways, talking about hours and converting hours into days, and you don't have to go past a certain day in June. So all those types of things will be discussed in the coming days in the General Assembly, I'm sure. So if you have ideas for that, and then we will know more as we progress through this as to the exact number of days that we will have to be closed.
Yeah, I'm going to do my best to summarize this question. They are concerned about a vulnerable adult staff member who is in the vulnerable population, 50 to 60 years of age, that has a health condition, but wants to come and work with children. And they're afraid they won't, they're just going to want to come work like most educators and people who work with children do. What advice do you have for them to give that particular population? If that employee has concerns, they advise the employee the employee should also obviously seek consultation from the employee's medical provider. I'm not sure if the question is about that teacher interacting with students. If we're closed, NTI, we're not. I think it's more like they're concerned about this person. They don't want them to get sick, but this person just wants to work with the kids.
So
or work and help, or wants to come help, maybe help with they're in an NTI thing where they would come in and still provide support in the school, either with food service or delivering food, something like that, versus staying home.
Well, the employee, if the employee has concerns, would need to consult with their medical provider, and then if there are just additional concerns about an employee that may be in a population that's more vulnerable, then you may advise to have conversations with your local health department for guidance about any protective measures or any other measures that would need to be put in place for that employee's workstation or work environment.
And this is we've kind of touched on this a little bit. Given that IDEA timelines are not suspended during NTI, what guidance would you suggest in having them available for an evaluation by the school psychologist during this time?
That goes back to, thinking about the social distancing and everything that we've heard today from the, public health, as well as the commissioner, as well as the governor. There are going to be situations that those timelines are going to be missed, and we recognize that. So, again, use your best judgment, follow those recommendations that's been provided, and then understand that we will be working closely with districts on the backside of this when we return to some kind of sense of normal to work through these individual situations.
And for those of us that are just joining us, Kevin, if you can just kind of reiterate the part about does the governor recommend that secretarial staff, assistants, other classified staff stay home during these NTI days? This is by far the most popular question, and I think we had some people that joined us a little bit late. And again, this will be archived and saved. You will be able to watch this later, but I thought since it is important, it would be good to address just one more time.
Okay, and I just want to let's just talk about and just use the governor's words. The governor spoke this morning at a press conference, and he reiterated what some things he said in last night's press conference. And the governor said, if teachers can work from home during this time, then let them work from home. If we can cut down on numbers of people in schools, then so much better. So again, what the governor is saying is that to the extent we can, let's increase the social distancing, and certified employees such as teachers are well positioned through technology to be able, assuming you're on an NTI day, to provide services remotely. So let's think outside the box, and we can confirm that the NTI process does permit you to allow the teachers to work remotely. And so what the governor is saying, to the extent you can do that, allow that to happen. That decreases the population of your building on a closed day. If you were going to have 25 teachers come in to implement NTI even with no students there, and you could say they can telecommute to do those same duties using their laptops and phones, then that's 25. Let's say you had 25 teachers in an elementary school. That's 25 less individuals in that building, because you may be having cafeteria staff, food service staff in that building, because you're providing food service, which is also supporting the public health. So the governor is saying, to the extent possible, think outside the box. Permit telecommuting if possible and if appropriate. And we are saying that you can do telecommuting under NTI and it be considered a contract day for those certified employees. We're not telling you you have to. To the extent you're bringing in staff to either staff your food service, to deep clean buildings, to implement NTI because you believe that teachers need to be there for technology or other reasons, and you're not comfortable with telecommuting, you can do that. However, you've got to keep in mind that social distancing is the key word. And so if you're bringing people in the building, you need to make sure you're keeping them apart. No assemblies, no bringing all the teachers together in the cafeteria for a quick meeting. Ms. Brown needs to go to her room. Mr. Allen needs to go to his room if you're bringing the teachers in. And then to the extent you have questions about your food service staff working together closely, then you need to have those conversations with the health department about precautions, about protective gear, gloves, et cetera, that they are, and our health department officials are experts in that area.
Does any more that have come in? If not, we might be wrapping up.
Tony, I have an update on my question.
Okay.
Go ahead. And this is on the ATC question?
Yes, on the ATCs, I just talked to Tom Thompson a few minutes ago, and we wrapped up the letter, and it should be going to the ATC principals on how to work with their districts. We are also approved for the remainder of this year for this situation for NTI in the ATCs. And we'll attach that. I'll have Tony send that out to all the superintendents so they'll see the messaging that the ATC principals are getting.
Okay.
And we fully expect our ATC principals will be working with their local feeder district superintendents to make sure that we're adequately working side by side with their plan.
Okay. Sounds good. All right. I don't think we have any other questions, so I guess we can wrap up. If there's anything else that our panel would like to share at all?
I would like to say one thing, Commissioner Brown, if I could.
Yes, sir.
I would like to stress the importance. You know, we don't know what these situations are like until we get into them. In our community, it was much different than what you probably are going to be facing in yours because of just the way that it came to Kentucky, okay? So in just a matter of so we had a local planning committee meeting on Saturday morning, and by Monday, our local newspaper, in partnership with the health department and others, had put together a circular that went to every mailbox in Harrison County. And it was full of information that they would need to be able to safely and effectively use real factual information. And so we led with facts and not fear so that we kept everyone informed. And just like the governor's done a tremendous job with his sometimes twice daily briefings, they are doing the same thing in Harrison County with our local health department and all partners. So it's important to continue to do that. It's important for us to do that as leaders in our district as well. And I would just say that we certainly are showing the rest of the country how to do this in Kentucky. And I applaud the direction of all of our leadership, from KHSAA to you to the governor and everyone, to take the actions we're taking. It's about flattening the curve, and we're gonna get ahead of this thing, and we're gonna beat it. So.
And I want to just
Thank you, Dr. Burchett.
I want to backpack off of that, and I do want to thank the news media for covering this the way they have been covering this, because we have been, we've been living this all week, and I've been dealing with reporters all week, and I just really, really appreciate, the coverage and the attention that you have given this matter. Just like Dr. Burchett just showed you, it's really, really important to get accurate, fast information, and we certainly appreciate it here at the department.
One more thing. We're talking about this social distancing. That's defined as 6 feet, okay? So let's just keep that in mind. We can't address these crises without people, and so it takes staff. We have been inundated by news media, not just in Kentucky, from around the country, calling and reporting on this situation. We have to have staff to deal with that. And so, again, I agree with you, as much as feasible, as much as possible, as much as what works in your district and your community, but social distancing can be done, and we can still work and accomplish things as well.
Absolutely.
Okay, I think that's good.
Any other items, any updates that we haven't discussed from the leadership team? So we have I think an address by President Trump coming up, if not already in progress right now. You may want to watch. We will have an update from another press conference from Governor Beshear around 5, I would.
Yeah, he's usually been doing those between 5 and 6.
That's on the governor's Facebook Live or in the governor's YouTube channel. And then the governor said this morning he will most likely be doing one press conference Saturday and one on Sunday. We may have missed a few questions because we're getting questions from superintendents by text, email, various people's emails. I apologize if we missed it. We're going to catch all that up over the weekend. We will continue to populate the Google document you will receive from us today. Will continue to be updated, so you'll need to check that. And I've been looking at the wrong camera apparently all afternoon. You have to have laughter, and with this, I just want to say that I am honored to work alongside some of the best professionals in the country, and educators, and our public health folks, and the folks here at KDE. So I want to thank you for that. And everybody have a great weekend. If you need us, I will say this: when the superintendents have your cell phone number, you do not need an alarm clock. They get up very early in Western Kentucky, I can tell you that. So everybody have a great weekend. Let us know what we can do to assist you, and we will have updates as needed. And take care. Thank you.
One more update for you on the closures. 161 of 172 districts, and that is as of 3:22 p.m. Have announced. That's according to us. And I know a lot of superintendents are asking if we've received their information. The short answer to that is no, because we don't really have a mechanism for that. So if I don't see you on this list, I will reach out to you. So just check your inbox here in the next 15 to 20 minutes. Thank you.
And on the final comment, because we are a family and a community in Kentucky, and our schools are our community centers, the governor was able to request that school districts close. And that's something, because other states will have to resort to a mandate. And so that is something that, to me, that's a sign of who we are as Kentuckians and how we operate our school systems and are operating our government. So just want to leave you with that. Thank you, and everybody hang in there.